The San Diego County Health Department says 40% of students stayed home from Patrick Henry and Del Norte high schools just on Wednesday, suffering from flu-like symptoms. Some preliminary tests were positive for influenza type A, and now the county is working with the state health department.
It is important to note, though, that the state is already involved with this. We certainly reported it up to them. I'm sure they're discussing it with their federal partners. Right now, though, this is occurring against the baseline of something that we expected to happen, and that's why we want people to be prepared.
The county's public health officer, Dr. Cameron Kaiser, warns this isn't just limited to schools.
If you're going to see a large number of people sick out in a geographic area, you tend to see it hit the schools first, not because it's not occurring other places, but that's simply because those are the ones who are keeping the closest tab on statistics.
And he says things are going to get worse, so this is not the year to wait to get your flu shot.
Across the county, we're seeing a large number of influenza cases and some of the largest counts we've ever seen for October. This is important for folks to realize that if it walks like a duck and quacks like a duck, it probably is a duck. And we already expected it was going to be a bad flu season, and everything is clicking into place.
Dr. Teresa Hardesty is a pediatrician with Sharp Reese Steely and says type A flu is particularly hard-hitting.
The natural immunity in the population has gone down, and influenza has really not circulated that much. So people are coming in with high fevers, serious cough, feeling achy and low energy. Usually with influenza, the fevers last for 4 or 5 days, and they can be as high as 104 or 105. So people are very uncomfortable.
But she says the safe way to build up your immune system is not to expose yourself to a bad flu.
The best advice to promote higher defenses is to give your body the pre-warning of the vaccine.
She says she's seen the worst cases in medically fragile babies, children under the age of 1, children with asthma, and pre-existing conditions. She urges parents to get them vaccinated if they're old enough. Plus,
I would recommend to be more cautious with exposure in large indoor groups in communities that have current outbreaks, probably for the next 2 weeks. And sometimes that's just not realistic.
When that's not possible, she says for children who are older, masking is an option, or talk to your doctor about medications that can protect them. And for those who are sick, plenty of rest and healthy foods are key to getting better. Kitty Alvarado, KPBS News.